welcome to my YouTube channel with me PURWA. So in this session, I would like to tell you about symptoms and illnesses. Okay, just let's check out my presentation.
Okay, now I would like to tell you about symptoms and illnesses. The goals for this lesson, the first one is to understand the vocabulary, and then the second one to use different words to describe pain, and then the third one to describe your symptoms to the doctor, and also to prepare for your visit to the doctor. Okay, so what does symptom mean? Symptoms are any feelings and signs of illness or discomfort which are caused by illness. Or in other words, symptoms are clues that help us and our doctors understand why we are sick. Symptoms is different with signs. Symptom can be defined as any feature which is noticed by the patient. Or we can call symptoms as the subjective data. For example, the stomachache, lower back pain, fatigue, which can only be detected or sensed by the patient, and the others only know about it if the patient tells them. And then a sign is noticed by other people or we call as objective data. It is not necessarily the nature of the sign or symptom which defines it, but who observes it. Signs can be determined by checking the vital signs. Well, when you're going to the doctor, you have to tell them your symptoms. The doctor may ask you, the first one, what's wrong with you? What's the problem? What's your complaint? Or what seems to be trouble? Or how are you feeling? And then, here I will give you the list of the symptoms vocabulary. The first one is dizzy. Dizzy, you feel like everything is spinning around you. You will feel wobbly or faint and lose balance or not steady. And then headache is pain in the head. And then cough quick noisy pulls away from mouth. And then toothache, pain in the chest. And then flu, an illness that affects breathing or stomach. And then stomachache is a pain in your stomach. Then fever, when you got a high body temperature and very little energy. And then vomiting, when you feel to throw up. And then swelling, when you have pop up. And bleeding, when you lose your blood. And then earache, if you feel pain in the ear. And then red, the irritation of the skin causes redness of the skin. And then numbness, when you don't feel anything. Drowsiness, if you feel sleepy, maybe after you consume the medication or the medicines, and then you will feel sleepy. And then diarrhea, if the watery poop or stool. And then the next symptoms is a trouble breathing or shortness of breath. You can't breathe well. And then tingling, feeling pins and needles in your body or skin. And then passing gas is that smelling air from bowels. And then congestion, when your nose is full, it is hard to breathe from your nose. And then itchy, you want to rub or scratch your skin. And then fatigue, if you feel tired or weak. And constipation, your stool or poo is too hot, so it doesn't come out. And then sneezing, a quick pulls away out of your nose and mouth. And then breakage, if you feel pain in your back. Runny nose, if the nose dripping watery. And then nausea, it seems like you feel like throwing up or feeling sick in the stomach. So throat, you will feel pain in the throat. And then sprains is a muscle injury, like when you twist your ankle. And wheezing, you make a wheezing sound when you break. Fracture or break a bone. And then sweating is a release of salt-based fluid from your sweat gland. Then cramp is a sudden and involuntary contraction of one or more of your muscles. Then you will feel loss of appetite when it is okay when you have a rigid desire to eat. And then redness, the flushing of the skin maybe, or redness in your eyes, the flushing of your eyes. And then clammy skin, if you feel wet or sweaty. and then checking chills or feeling of being cold without an apparent cause. Now, weight loss, a reduction of the total body mass by mean loss of fluid, body fat or adipose tissue or lean mass, namely bone involved deposit, muscle, tendon, and other connective tissue. Then chicken pox or varicella is an infection caused by the varicella zoster virus. It causes an itchy rash with small fluid-filled blisters. And then rubella or German measles is a viral infection that causes a rash on the body. Then measles or rubeola, with the symptoms fever, rash, and inflammation of the upper respiratory tract. And then we have mumps or infectious parotitis, swelling in one or both of saliva producing or salivary glands. Whooping cough or pertussis, marked by a severe hacking cough followed by a high-pitched intake of breath that sounds like whoop. Well, if symptoms continue for many days, you have to visit your doctor. Then, if you don't do it, it may cause more problems. So, if you have the emergency conditions, you don't need an appointment at urgent care center, and then you have to go to the nearest hospital, and then you should go to the emergency department. Okay, the condition when you need to go immediately to emergency department is unconscious, when the person is not awake but not asleep and will not wake up or doesn't respond. And a heart attack when the heart gets damaged or hurt, and a stroke, sudden loss of brain function because when the supply of blood to the brain stops. Then asthma, disease that makes it hard for people to breathe. Then SEIZURE, sudden attack of shaking and unconsciousness. Well, once you go to the doctor will ask to you about your symptoms, and then it is very important to you to describe your pain clearly. How strong is your pain? Like the scale from the range from 0 until 10. 0 means no pain, and then mild, moderate, severe, very severe, or worst pain possible.
Yeah. Thank you for watching my video. Don't forget to like, subscribe, and share. Bye bye.